Good morning, everybody. I want to bring you up to date on the latest information in regard to East Palestine. The U.S. EPA, in partnership with an independent contractor, continues to monitor the air in and around East Palestine. To date, they have sampled air in over 500 separate homes. They've also continued to sample air out on the streets and throughout the community. So far, they've had no detection of contaminants, either outside or in the specific homes where they've been asked to monitor. Volatile organic compounds, or VOCs, are generally present in things we come in contact with every day: paint, flooring, carpet, furniture, cigarette smoke. Although the testing in approximately 75 homes did show elevated levels of VOCs, further testing in those 75 homes found that contaminants of concern from the derailment were not present in those homes. So nothing from the train derailment was found in the homes. Nothing was found out on the street. The monitoring will continue, however. Today, more than 24 additional homes are scheduled for air testing. The teams are still taking appointments for those people in East Palestine who want to schedule a screening of their home. That number is 330-849-3919. In summary, in the 500 homes where the air has been tested, no contamination of concern caused by the rail derailment was present in any of these homes. There are in the community 20 monitors strategically located throughout the community to continue to monitor outdoor air. I think we have a map somewhere, I hope. There's a map there. This is a map from the U.S. EPA that shows all the places where they've taken outdoor air samples over the past 2 weeks. Again, the experts tell me that these monitors are coming back clean for contaminants of concern associated with the train derailment. So this monitoring started very early on. This monitoring will continue. We will continue to do this. So we have 20 monitors. These monitors are moved around, and they will continue to be moved around the community. Let me now talk about water, residential well sampling. As we talked about earlier this week, the testing results from East Palestine's municipal water source have come back, and the results are that drinking water, testing those 5 wells that go into the community system, those 5 wells have all come back clean. The water is safe to drink. We never thought that the municipal water was contaminated, but out of an abundance of caution, our Ohio EPA took samples which were analyzed, and they in fact came back and were shown to be safe. You do not need to drink bottled water if you are on municipal water. If you get your water from a private well, you are encouraged to use bottled water until your water is confirmed to be safe. That, again, is just out of abundance of caution. To date, 38 private wells have been sampled. More private wells are scheduled for testing today. These samples, unfortunately, take a while to get it back from the lab. So we don't have any results back yet, but we expect them very, very soon to start coming back. Again, to schedule testing for your private well, call 330-849-3919. Let me talk now about the Ohio River. When we met earlier this week, the Ohio EPA discussed the chemical plume in the Ohio River. I'm happy to report this morning that sampling has shown that the plume is now completely dissipated. It was never thought to be a threat, but they could get slight detections. And I want to mention that something I've learned during this is the Ohio River is monitored normally very extensively. And so they were able to pick up, before they were able to pick up where that plume was. It was never thought to be very high, never thought to be very dangerous, but they could detect it as it moved down river. Now we're told that they cannot detect it at all. To give you some idea of the numbers, the level of concern for this contaminant is 560 parts per billion. Readings yesterday, when we could still get a reading on it, were under 3 parts per billion. So again, level of concern 560. Yesterday it was at 3. Today it is at 0. The levels at which this chemical was in the Ohio River have always been very low. We are no longer getting readings at all. I'm told that some water systems along the Ohio River will close their water intake lines for the time being out of an abundance of caution. We understand that. That's perfectly fine, but we do believe that there's no reason to be concerned about water now from the Ohio River, and there's never really been a reason to concern, and we no longer can get any reading at all of this contaminant. Let me go to the local creeks. You know that there's been some video played on TV of circulating of visible physical contamination in one of the local waterways. A section of Sulphur Run that is very near the crash site remains severely contaminated. We knew this. We know this. It's going to take a while to remediate this. It will be remediated, but it's certainly a place to be avoided at this point. Very soon after the crash, Sulphur Run was dammed, so the contamination in that part of the creek does not contaminate any of the other water. It was kept in there and on hold. In fact, teams are pumping clean water from the point of the eastern dam, funneling it away from the contaminated section of the creek and releasing it back into Sulphur Run at the western dam, so diverting it around where the contamination is. This occurred early on after the crash. This allows clean water to bypass the area of the derailment and prevents clean water from picking up contaminants and carrying them into other waterways. The remediation of the water in the direct area of the spill is going to take some time, just as it is taking some time to deal with the dirt. This is not a simple process. We're encouraging people to continue to avoid that area. Now, I know there's been a lot of questions about FEMA and calling in FEMA for aid. At this point, based on what FEMA has told us and continues to tell us, my chief of staff talked to them again this morning, we do not qualify for assistance. Although FEMA is synonymous with disaster support, they're most typically involved with disasters where there's tremendous home or property damage, tornadoes, flooding, hurricanes. That's why we do not expect that FEMA will come to East Palestine. However, to make sure that if in the future FEMA is ever needed, we want to preserve our rights to be able to ask them for help. So, to make sure that if FEMA is ever needed in the future to help residents in regard to this crash, we're going to preemptively file a document with FEMA to preserve our rights in case we need their assistance in the future. We believe that the railroad should continue to pay, and we're going to insist that they pay. Whatever damages have been caused, the railroad is responsible for those damages. We're filing this paper with FEMA just in case in the future we need that. Let's say, for example, the railroad stops paying for whatever reason. We're still going to go after the railroad, but we want to make sure that there will be support for people if that support does, in fact, stop from the railroad. Let me move now to HHS. We know that the science indicates that this water is safe, the air is safe. But we also know, very understandably, that residents of East Palestine are concerned. They ask themselves, they might have a headache. They might ask themselves, is this a headache, or is this headache that is in fact caused by the train derailment? Or other medical symptoms they may be experiencing caused by the train derailment. These are very legitimate questions. Residents deserve an answer. They have suffered a great deal. This has been a traumatic time for them. This has been a horrific train derailment, and we understand, have some understanding of what they've gone through. We've asked for medical experts from the United States Department of Health and Human Services to come to East Palestine. This request has now been granted by HHS. We are now going to establish in the next several days a clinic in East Palestine. This is a clinic that will be established by the Ohio Department of Health. We will get assistance and help from HHS. We want them to be able to engage with the residents of East Palestine. We want them to be able to answer the residents' questions, evaluate symptoms, provide their medical expertise. The people who will come in, and we expect them in early next week, will also have access to the best experts in the world in regard to chemical exposures. Again, we are doing this because we know the concern that has been expressed by so many of the residents. Dr. Vanderhoff spent a few days there. He talked to a number of residents. Other members of our team have talked to residents. We know the concern that they have. And they're very, very understandable, and they deserve answers. Working with the Ohio Department of Health and the U.S. and Ohio EPA, they plan to begin seeing patients early next week. Information on the location of the clinic and the hours that will be available as soon as we have them, and it will be on the website at ema.ohio.gov/East Palestine. Again, that is ema.ohio.gov/East Palestine. So we expect them to come to town probably on Monday, and we will be in the process of putting that clinic together. Again, we know that there are some people who do not have insurance. We also know that we have people who may not even have a primary doctor. We want to make sure they have a place to go, a central place where they can go to get help. Again, this is not based on anything that we're seeing in the sampling of the air. It's not based on anything we're seeing in the sampling of the water. Water is good to drink if it's coming from the municipal water system. The air, we will continue to monitor the air, but so far we've seen nothing in regard to the air out of the ordinary. But we'll continue to do that. We know that this whole last several weeks has taken a tremendous toll on residents in East Palestine. We know that this has been a traumatic experience for all of them. Working with the County Alcohol, Drug, and Mental Health Board, we are supporting a number of local mental health resources. Information will be available on our website later today, again at ema.ohio.gov/East Palestine. Again, that's ema.ohio.gov/East Palestine. In addition to these local resources, the Ohio Care Line is open 24 hours a day and staffed with trained mental health professionals who are there to listen and to help. All calls are free and confidential. They can also connect you with local resources if follow-up care is in fact needed.
We have just been listening to Ohio Governor Mike DeWine give an update to the public about the situation in East Palestine, Ohio, following that train derailment and concerns about toxic chemicals in the water and also the air. As he talks, you see images on your screen of dead fish. So what you're hearing the governor say just moments ago may come as a surprise to some people, but here is what the governor said, just to recap. He said there has been no detection of contaminants. He said the municipal water, they've tested 5 different wells for sampling. The water is safe to drink. He also said they have been testing the air and they have no indication that there are contaminants that are harmful in the air. A couple other headlines. This gets a little granular on the numbers, but they said a level of concern in the water and air, 560 parts per billion of this chemical that leaked from the train derailment. He said under 3 parts per billion is what they detected. Today, they detected 0 parts per billion. So you hear the governor telling the people of East Palestine, your water is safe, the air is safe, we're going to continue to test it. One caveat the governor did say, he is encouraging people who are on well water systems to have their well water tested. Another major development, FEMA, he said, will not be coming to Ohio to offer assistance. He said at this point, Ohio and this disaster does not qualify for FEMA assistance, but they are in touch with FEMA. Really important to note, though, the governor said, and I believe he pounded his hand on the podium when he said, we will insist that the railroad pay for this disaster, the cleanup, the monitoring of the air and the water moving forward. He insists that the railroad will pay. To the concerns of residents living in East Palestine, and there are a lot of them, people who say they have felt sick. They see the images of the dead wildlife. They are concerned. They don't want to go home. If you put yourselves in their shoes, you understand the level of concern about their health and about their safety. To that, the governor says, you have gone through a traumatic experience. We hear you. And in response, he said, if you are feeling sick, we want you to get help. To that end, they have requested and been granted medical experts to come to East Palestine, Ohio. They're establishing a clinic that the Ohio Department of Health will oversee. People can come as early as next week to have their health issues addressed so that they have peace of mind. He said, if you start feeling sick, we want you to get medical attention. We hear you. In addition to that, to the traumatic experience this has been for so many, the governor said they're also setting up mental health resources for people who are living in East Palestine. So again, the headline, as you hear from Ohio Governor Mike DeWine, and I just spoke with a member of the health department there in Columbiana County, Ohio, saying, we have tested the water in the municipal area of East Palestine, and the levels show it is safe to drink. We are testing the air. We have no concerns about contaminants in the air at this point, but they will continue to test and monitor. That's a tough pill for a lot of people to swallow if you're living in that community. The governor seeming to sympathize with people's concerns, their lack of trust in the information, but at this point they're saying the water is safe.